Hello, I'm Dr. Rob Rogers. I've been practicing dental sleep medicine for close to 30 years and have placed over 10,000 oral appliances. As such, I have considerable experience with the evolution of numerous appliances over the years and am familiar with the advantages and limitations we experience on a daily basis. Over time, I've developed an appliance that is actually 3 appliances in one. This allows us to meet specific patient needs without incurring the time and expense to completely fabricate a different appliance. This new appliance is called the Medley. It is patented with FDA clearance, and I've been using it almost exclusively in my office for the past 5 years. Let's take a look. Here we see the complete platform that will accept 3 different design applications. By utilizing different attachment locations, the Medley will accept rigid nylon links, elastomeric straps, or a Herbst apparatus, depending on patient needs. Each of the design applications can be placed or removed within 90 seconds in the office by the dentist or chairside assistant. This is the rigid nylon link design. It is similar to the other nylon link designs you may be familiar with that have been in use for years. These links generally will not stretch or break and may last a year or 2. The links come in a set of 6, offering 6 millimeters of advancement. If additional jaw advancement is needed, the upper screw can be quickly moved into the anterior hole, chairside, and the entire 6 links can be utilized over again to gain an additional 6 millimeters in advancement. Conversely, if less mandibular advancement is needed initially, the lower screw can be moved forward to allow the mandible to retrude in a more comfortable position. Personally, I use this link design for approximately 80% of my cases. Here we see the elastomeric design. The elastomeric straps utilize the same holes as the link, but require placement of a larger head screw. These are the same elastomeric straps you may be familiar with, traditionally used in other elastomeric appliances. This design serves my patients best when I need a shock-absorbing quality with the advancement mechanism. I find that this allows tender jaw joints to heal while retaining the efficacy of the appliance for a certain amount of time. When appropriate, the appliance can be transitioned back to the rigid nylon links, or as needed, maintained on the elastomeric straps long-term. This is the rod sleeve design that utilizes the standard Herbst hardware. You'll notice it utilizes different location holes than the link or elastomeric design. It also employs a specialized pivot screw that attaches to the ends of the Herbst arms. It works well for dentists and patients who prefer the Herbst type mechanism and is PDAC approved. As with the other design applications, the rod sleeve can be placed and removed within 90 seconds chairside by the dentist or assistant. Here we see a variation of the complete platform that only accepts the nylon link design and the elastomeric design. It lacks the location holes to accept the Herbst rod sleeve design. This is very useful for dentists who are certain that they do not need the rod sleeve application for any reason and cost less. Okay, so let's see how simple this really is. We're going to transition into 3 different design applications in a matter of minutes. We're starting with the complete base, which is comprised of 1, 2, 3, 4 location holes. The nylon straps and elastomeric bands will extend from the upper anterior to the lower posterior, and the Herbst arms will extend from the upper posterior to the lower anterior. So let's put the links on first. Before we start though, I'd like to let you know a little helpful hint. You'll be supplied with a wrench like this, which works fine. But if you put an acrylic or thermacryl handle on it so that you can twist it easier, it works a whole lot better. In addition, in order to retain the screw head to the wrench or the screwdriver, if we just put the tiniest film of wax on the tip and then place it in the screw hole, you'll notice that it won't come off. You have complete control over it. So let's put the link screws in first. They will be placed on the upper anterior support, but in the distal hole. Go back to my wax. Another link screw Again, it stays on there. And on the lower arch, we want the posterior support, again, the distal hole. We'll take our link. These come in 6 different sizes. They can be identified by the little bumps that are on here, and they are applied quite simply. And you would do this to both sides, of course, but for sake of time we won't. And in less than a minute we have the link application. If we have a joint that is a little bit tender that we would like to be more kind to and give it a cushioning kind of effect, we simply take off the link screws and get the larger head elastomeric strap screws. Again, wax on my wrench, same holes. And these are the elastomeric straps that you're used to seeing in many other appliances that you've used. These are easier to place than the other appliances because the screws stay on, they don't pop off. And again, in a matter of a minute or two, you have the Elastomeric Design application. If we want to go to the Herbst application or the rod sleeve, in another 15 or 20 seconds we can remove that. And in this case we're going to use a different screw, which I'm going to call a pivot screw, and this accepts the eyelet of the rod sleeve, which is simply a Herbst appliance. Again, wax in here. If we apply the Herbst arm like this, and now we're going to the upper posterior support. It's easier to place these together at this point, and then get hold of that screw and place it right in there. And again, within a minute or so we have a Herbst design which is PDAC approved. If this is not what you want, 20 or 30 seconds later you can take it off, and you can do this, your assistant can do it. Quite simple. And really that's all there is to it. You can go between all 3 components, all 3 design components in a matter of minutes. As you can see, the Medley offers 3 different designs in one single appliance. This allows the dentist to meet the patient's needs without wasting time or money completely fabricating a new appliance. The rod sleeve version is PDAC approved. In the event that the Herbst arms may not be necessary, the Medley can be fabricated to accept only 2 designs, the nylon link and the elastomeric strap. This will lower the cost of the appliance.